when the person first comes in, walks into your office, and what the process goes like. How does one access neuropsych testing?
Neuropsychological evaluations can be held for a different variety of reasons. And so there is different settings where you will find neuropsychologists. So for example, if you're an adult and you've been in an accident where you had a brain injury, or you're finding that there is some concussion or effects, cognitive effects that are impacting your memory, then there might be a neuropsychologist on staff in the hospital that conducts an initial evaluation to see what the results are, where you're having difficulty. And typically, then there are some follow up evaluations that are done. Whereas if you're a child and say you're having learning problems, so a child might be very bright, but maybe they're having difficulty learning one subject, say they're weak in math, and that's causing them not to have academic success, then the school can also do an evaluation. But if the school doesn't have the resources, you can ask for an outside evaluation as well. And so the neuropsychologist can do an academic and a behavioral assessment to see what might be causing some of the problems that the child is having in school that are interfering with the child's academic achievement. And then based on that, the neuropsychologist can work with your school, attend what are called IEP meetings, and help the school implement some of the strategies that might be helpful for the child. Similarly, if you're having trouble at work, and say you have an undiagnosed ADHD and you're an adult and you're not able to progress in work, then you can come in for an evaluation. Now, as an adult, typically most insurance companies do cover neuropsychological evaluations, and most of them do not require authorization anymore. They used to in the past, they don't anymore. But there are some companies that still require authorization. And typically, if I'm seeing someone through insurance, then I will ask for what's called a pre-certification and to make sure that that's covered. But if the person is out of network, you can still, and you have a PPO plan, you can still go to the neuropsychologist and they will do the evaluation for you and give you what's called a super bill. And then you can submit that to your insurance. And depending upon your benefits, they will reimburse you. If you are going through insurance, I would highly recommend getting a referral from your either psychiatrist or a primary practitioner, because they can discuss with you what the benefits of neuropsych testing can be and also give you that referral, which will help you see whether it's medically necessary. So that's through insurance, I would say that would be the best route to take. Now, you can always initiate a referral on your own as well. So if you're feeling like there is some issue coming up and you can pay out of pocket, and typically, if the psychologist gives you a bill, you can submit that to your HSA plan as well. When a child might show some autistic symptoms, we're very likely to say, oh, it's nothing. Let's just try and ignore it, or it'll go away as they get older.